Good evening. My name is Aris Dermitzakis. I am a member of the Institute of Biomedical Technology, and I'm here to represent your study for the distribution and utilization of CT and MRI units in Greece. This study was conducted by myself, Aris Dermitzakis, head of the Medical Device Management Unit in Institute of Biomedical Technology, and Professor Nicholas Palikarakis, who is the president of Institute of Biomedical Technology. As we all know, biomedical and clinical engineering is playing a leading role in the development of medical technology, which is one of the main pillars of our modern medicine. A very big part of this technology is the high capital value imaging modalities. And this is where also this study focused to. We're focusing on imaging modalities that have high capital value in terms of initial investment and operation that are required special trained personnel in order to be properly used. The imaging modalities that have needs of regular quality control, needs of preventive maintenance, and extensive management procedures in order to make sure that they will function properly and most of all safely for the patients and the users. Clinical engineers have a key role in facing all these challenges. They are the ones that are responsible for the correct maintenance of all medical devices in a healthcare unit, and this happens for the whole life cycle of the medical device, starting from the planning of acquiring a medical device up to the time that the device no longer has to be installed into the medical unit and has to be disposed. Medical imaging has a huge positive impact in early diagnosis of serious health disease, and the medical modalities have resulted in an increasement and improvement of the quality of health care given to the patients, and this is very widely acknowledged. In this study, out of all the high capital value imaging modalities, we're going to focus on the magnetic resonance imaging and computer tomography in Greece. We are going to provide you data about the situation of MRI and CT installed units in Greece up to 2017, and we are aiming to assess the sufficiency and equity in the distribution, to identify eventual inequalities in terms of geographical coverage, and estimate the cost of use. Now, when we were conducting this study, we had a major problem, which was the fact that there was not the countrywide medical equipment inventory available in Greece. This means that we couldn't have a very clear image of what are the exact number of units installed in the country. That is when we had to find different sources and then combine all the data in order to end up into the numbers that you're going to see now. First of all, let's see the geographical distribution. You can see that we have a lot of inequalities, both for CT on the left and MRI units on the right. That we have areas that they have a lot, areas that have none of them, and this causes a lot of troubles. Both modalities have a very good installation base in Greece in terms of number of units. The number of units it's constantly increasing, at least since 2005 that we have data here that we show you, and as expected the number of CT scanners is bigger than the number of MRI scanners. CT is an older technology than MRI. It was available earlier than MRI. They are cheaper and they are also easier to install. Now, however, although we have a lot of scanners, both for CT and MRI, higher than the mean of the rest of European countries, only a few of them are new. And this is very important because it is very important to see what is the age of all these machines. As you can see here, we have only, most of our CT scanners are scanners that are of 1, 2, or 4, or 6 number of slices, which is very, very old, and only very few of them are of 128 and higher, which are the modern CT scanners. The same thing happens also for the MRI, that you can see that we have a lot of scanners with magnetic field of 1 Tesla or lower, and we have a very few scanners that are of 2 or 3 Tesla in magnetic field. In fact, 20% of the installed CT scanners are over 15 years old in Greece, and 25% of the installed MRI scanners are over 20 years old. This means that the installed base is very, very old. Concerning the distribution of CT units, here we can see a graph that shows us the number of CT units installed in each regional sector. With yellow we have noted the public sector scanners, and with blue the private sector scanners. As you can see, we have some areas, a lot of areas, that there is no CT scanner available, and most of them are islands like the island of Andros, Kythnos, Milos, etc. Another important thing to notice is that we have some areas that there are only private sector scanners available, like the island of Mykonos, Naxos, Paros, or Preveza, let's say, or Santorini, which is very, very important, because this means that if a patient in one of these islands needs to have a CT scanner, then either he would have to go to a private sector and pay for his scan, or if there is no scanner at all available, as in the case of Milos, let's say, then he would have to travel in order to have a CT scan. He might have to take the boat, or might have to take the airplane if there is an airplane available, which is very, very difficult for the patient. The situation is the same or even worse for the MRI units. As you can see, again we have with yellow the public sector and with blue the private sector scanners. You can see that we have a lot of areas, mostly islands, that have no scanner at all, which means that the patients have to travel again, as in the case of CT, and we have even more areas where only private MRI units are available, which means that the patients need to pay in these areas in order to have an MRI scan. Now let's see about the expenditure of CT. As you can see, there is a small increase during the last years, but more or less the public sector has the same number of acts and the same expenditure for CT. The same happens also for the private sector, and in total 2016 up to 2016 the cost for the CT scanners that EOP, the National Organization of Healthcare Provision, was paying for CT scanner was around 91 millions. For the MRI scans, the cost is a bit lower because the number of acts is lower than the number of CTs performed in Greece. Here we have a small increase of the number of acts performed into the private sector instead of the public one, that has been decreasing slowly over the years. In total, the cost in EOP, the National Organization of Healthcare Provision, is around 55 million euros during 2006. In terms of the number of acts performed for CT and MRI, you can see that in 2008 we had a great number of MRI and CT scans performed, which was greatly reduced after that due to the economic crisis, leading to 1/3 of them in 2013 for the CT and half of them for the MRI. Since then, CT scans have been more or less held the same, but MRI scans increased by 22% more or less. In conclusion, we can see that private sector is more present than the public in both facilities, and that private sector is the only provider for CT and MRI imaging in some parts of central Greece and some islands. We have a particularly poor coverage in the Aegean Sea islands, and most of the islands lack of modern diagnostic imaging equipment. In terms of cost of use, we have large dependencies in the number of exams performed in the different areas of Greece, and there are also some indications of overuse in particular areas. Thank you very much, and I will be happy to answer to any questions that you might have.